Marker, it says it's the right knee. That is correct. This is the right knee. The fibula is on the lateral side over here. So that means this is the right knee. It is also weight bearing, meaning that the patient was standing or bearing weight on their knee as an x-ray was taken. Now, I will say it depends on where you work. Generally, in my practice, if the patient's coming in for pain, arthritis, or any kind of thing like that, the first one, we do weight bearing of both knees for comparison. This one is only showing one. Yeah, that's okay. But that usually what we do is to do both knees to compare how little the joint space is or how bad the arthritis is. Okay. Anyway, tangenting. So the marker is correct, and this is an extra marker that they would have put in, obviously a digital marker, to say that it is weight bearing. Now, the weight bearing actual word, it's 2 words, is quite long. So is that the reason why the collimation was quite wide? Probably not. But so anyway, what you could do instead of writing weight bearing, just do W/B or just WB. All right, or erect. They all kind of refer to the same thing. And so if you don't have too much space on your x-ray, just write one of these and that should be fine. It's really saying the same thing. So that's in terms of marker. Aesthetics and artifact, I don't really see any artifacts in this case. All these sort of lines, I think over here are potentially just the patient's clothing, if anything. It seems quite normal. That haloing effect at the bottom just means that's where the actual collimation ended. So no artifacts. Aesthetics is quite good. Again, the only thing would just be to fix the centering slightly and bring the coating or collimation in side to side, and it would be really, really good. Okay, and one other thing I forgot to mention in terms of the positioning is that the position of the, I know it's not rotated too much because of the position of the patella, and you can see the outline of the patella over here. It's sort of right within the center of the knee. It's not sort of towards this way or that way or anything like that. It's right in the center, which means that for this particular AP knee, it was positioned really well. And lastly, N for name, no name or identification seen for anonymous purposes. Any pathologies? I don't really see any pathologies per se. There is a bit of a sort of a bump there. It's probably within normal limits. I don't really know if there's anything of interest. Other than that, in terms of bone density, I'd say there's a little bit of osteopenia going on, reducing in bone density. And I can tell because, at least from what's visible here, the cortex is relatively thin to what I would have expected it to be, okay, in the femur at least. So hopefully that made sense. Let's move on to the next one.